Blood Purification Therapy, Lesson 9, Dialysis Fluid. This unit covers the basics of blood purification therapy. The goal for this lesson is to understand the composition of dialysis fluid and the importance of purification of dialysis fluid. This is the content of this lesson. Diffusion in dialysis is based on the difference in the concentration of substances between the blood and the dialysate, where mass transfer takes place. Therefore, the composition of dialysate components is very important. The dialysis fluid commonly contains 7 electrolytes as its components, as will be explained hereafter. Firstly, sodium plays a role in osmotic pressure, and a physiological concentration of 140 milliequivalent per liter is the mainstream for sodium. The second electrolyte is potassium. Since patients with renal failure have hyperkalemia, a lower concentration of 2.0 milliequivalent per liter has become the mainstream. Thirdly, for calcium, concentration of 2.5 milliequivalent per liter is the most common. However, there are various symptoms of both high and low levels of calcium, and there is still a lot of debate about the concentration of calcium in dialysis fluid. The fourth is magnesium. Since there is a tendency of higher magnesium concentration in patients with renal failure, a lower concentration of 1.0 milliequivalent per liter is the mainstream. The fifth electrolyte is chlorine. Chlorine concentration is commonly set at 110 milliequivalent per liter, which is slightly higher than normal value. The sixth component is glucose. Due to the occurrence of hypoglycemic symptoms caused by dialysis, concentration of 100 mg per deciliter is most common. Lastly, bicarbonate concentration is usually fixed at around 25 milliequivalent per liter because patients with renal failure are likely to have the symptoms of acidosis. Recently, dialysis fluid, or dialysate, is also used for priming dialysis circuits and online hemodiafiltration as well as diffusion. Since the dialysis fluid comes into direct contact with blood, purification of dialysis fluid is essential. Therefore, it is crucial to measure endotoxin in the dialysis fluid every month to ensure that the level of endotoxin is below the standard value. Endotoxin is a toxin produced by gram-negative bacteria, and if a large amount of endotoxin enters the bloodstream, it can cause the symptoms of shock, fever, and a drop in blood pressure. In Japan, the standard values are strictly set by the Japanese Society of Dialysis Therapy. This is the end of Lesson 9, Dialysis Fluid. Make sure you've mastered the basic concepts before you move on to the next level.